concern was my shoulder was in such bad shape I couldn't raise it up to put on a shirt or put a belt in my pants or anything of that nature. And I thought it was going to be a rotator cuff, which a lot of people have. And then once they x-rayed, they said, no, I needed a total shoulder replacement. So I said, oh, okay, I'm not sure about that. But after I talked to Dr. Walker, and he showed me that he did a lot of these and very experienced in it, and I said, well, okay, let's go for it. I guess when I first met Dr. Walker, and he explained it to me, then they showed me a little film on how this procedure was going to take place and all what he was going to do, and he just seemed to be very confident in what he was doing, and showed me everything would be good. So I said, okay. The nurses were great, and they took care of me, and like I said, they made sure I was comfortable in all ways. They just treat you really nice and look out for you, and I was very pleased and satisfied with them. You know, he come in, checked on you every day, and make sure everything was going well. But like I say, you only stay here one night, so once they got everything situated, well, there was nothing wrong with the procedure and all, so they're shipping me out of here. And then I got the doctors, the nurses and the physical therapists and all to take care of me at home for a couple of weeks, and then it was on to physical therapy, and that worked. I think I was only there 6 weeks, and I was getting way ahead of the class that was had rotator cuffs, and the physical therapist was kind of shocked that I could raise my arm up as far as I could, and so I said, okay, this is good to me. So they turned me loose. That went so well. Then I come back a year later, and I had the second shoulder, the right shoulder, done, and same procedure and same doctor. Like I said, I definitely would choose Dr. Walker again, and everything went fine. And he keeps checking me every 6 months to a year, and he said, boy, that looks good. Now, everything looks good on the x-rays. And so I said, well, it looks good because you did a good job.